Stanford University.
Well, now I want to deal with the anterior surface of the thigh, and first of all we'll put in the anterior superior iliac spine, and we'll indicate the position of the superficial inguinal ring, which you remember is an opening in the aponeurosis of the external oblique muscle. And here I can just indicate the position of the pubic tubercle. Now the skin of the lateral surface of the thigh extends down in this manner, and the skin on the medial surface of the thigh extends down in that way. And I'll just indicate the position of the underlying patella in that manner. Now, extending between the anterior superior iliac spine and the pubic tubercle, we have the inguinal ligament. And you remember that the inguinal ligament is the lower thickened margin of the aponeurosis of the external oblique. And I'll just indicate the position of that ligament in that manner. Now let us put in the sensory nerve supply to the skin of the front of the thigh. You'll remember that the 12th thoracic nerve, the subcostal nerve, sweeps round the side of the abdominal wall and then sends off a branch which extends into the upper lateral part of the thigh. So this is the lateral cutaneous branch of the 12th thoracic nerve. Coming down under the inguinal ligament, we have the femoral branch of the genitofemoral nerve. You'll remember the genital branch of the genitofemoral nerve supplied the cremaster muscle. This is the femoral branch of the genitofemoral nerve. So the stimulation of this nerve will cause contraction of the cremaster muscle in the male. Coming down through the inguinal canal, we have from the first lumbar nerve the ilioinguinal nerve, and having emerged from the superficial inguinal ring, it supplies the skin and the root of the penis or the labia in this region here. Now what about the sensory nerve supply to the front of the thigh below that level? Well, you remember coming down underneath the inguinal ligament, deep to the fascia lata, we have the lateral femoral cutaneous nerve. This pierces the fascia lata about a hand's breadth below the anterior superior iliac spine and supplies the skin down the lateral side of the thigh, usually sending a branch round to the posterior surface. And then another nerve here coming through the deep fascia is the intermediate cutaneous nerve of the thigh, the intermediate femoral cutaneous nerve, which are branches of the femoral nerve, and they pierce the deep fascia and come on down to supply the skin right down as far as the patella. The intermediate femoral cutaneous nerves, branches of the femoral nerve. And lastly, down here we have the medial femoral cutaneous nerves. The medial femoral cutaneous nerves are branches of the femoral nerve, and they come down on the medial side of the patella, right down as far as the medial side of the knee joint. Now this leaves a variable area here, which is supplied by a small branch from the anterior division of the obturator nerve. So now we have the whole of the sensory nerve supply at the front of the thigh. And so we can see the sensory nerve supply at the front of the thigh is as follows. We have here the branch from the 12th thoracic nerve. We have here the lateral femoral cutaneous nerve coming down the lateral side of the thigh, sending a branch posteriorly. We have here in the middle the intermediate femoral cutaneous nerves, branches of the femoral nerve. We have here the femoral branch of the genitofemoral nerve, and we have down on the medial side here the medial femoral cutaneous nerves, which supply the medial side of the thigh down as far as the medial side of the knee joint. We have up here the ilioinguinal nerve coming through the superficial inguinal ring here and supplying the medial side of the thigh and the adjacent part of the genitalia. And lastly, we have a small variable area here which is supplied by the anterior division of the obturator nerve. The superficial veins of the lower limb are very important clinically. I don't think it's appreciated by many that the superficial veins are commonly diseased and cause varicose veins, and varicose veins cost this country many $millions a year in the treatment costs. So let us first of all consider the distribution of the superficial veins of the leg. Now, if this is again the region of the anterior superior iliac spine, we can continue the skin down the lateral side of the thigh, lateral side of the knee, lateral side of the calf, and go on to the lateral side of the foot. And in the same way, we can consider this being the medial side of the thigh, medial side of the calf, and then the medial malleolus of the tibia, and then the heel of the foot going down the medial side of the foot. And we can just indicate the position of the patella in that sort of way. Now, you may remember that up in the front of the thigh, below the region of the inguinal ligament, the deep fascia has an opening called the saphenous opening. And I'll just indicate the position of that opening in that sort of manner. Now, the great or long saphenous vein starts in the foot by being a continuation of the medial side of the dorsal venous arch. And I'll indicate the position of the dorsal venous arch in that manner. Now, coming off the medial side of that dorsal venous arch, the great or long saphenous vein passes up in front of the medial malleolus, directly in front of the medial malleolus of the tibia. It then runs up the medial side of the calf and then passes behind the knee. In that way, only to emerge on the front of the thigh again and pass up in this way across the medial surface of the thigh, finally passing through the saphenous opening to drain into the femoral vein, which is lying in this area. So here then is the great saphenous vein draining the medial side of the dorsal venous arch, passing up in front of the medial malleolus of the tibia, running up the medial side of the calf, passing behind the knee, and then running across the medial side of the thigh to drain into the femoral vein. And the surface marking of this point is about 1.5 inches below and lateral to the pubic tubercle at this point. Now, what are the tributaries of this important vein? Well, clearly it is receiving tributaries from small veins as it's passing up the medial side of the calf, and there's usually a fairly large tributary, sometimes known as the accessory vein of the thigh, as it's crossing the front of the thigh. As it's passing through the saphenous opening, it receives 3 important tributaries. One from the genitalia is known as the superficial external pudendal vein. This joins the great saphenous vein as it's passing through the saphenous opening. Then there is the superficial epigastric vein, which is coming down from the skin below the umbilicus and draining into the great saphenous vein as it's piercing that saphenous opening. And finally up here we have the superficial circumflex iliac vein, which comes from the skin in the region of the anterior superior iliac spine and passes down and joins the great saphenous vein at this point. Clearly, any treatment of the great saphenous vein where the operation of stripping the vein or ligating the vein requires that these smaller veins are ligated also. Now, if we pass over to a picture on this side, we'll look at the back of the leg. We indicate the position of the back of the thigh coming down into the popliteal space. Then we'll indicate the position of the calf and the lateral malleolus, and then we'll show here the heel and the sole of the foot in that manner. So this is the lateral side of the leg. We've turned the leg round. So this is the lateral malleolus. Now, passing up